Hello, my name is Aislinn Hart,
My name is Jaden Nelson.
And my name is Betsaida Uraga Rosales.
and today we will be discussing the burden of hepatitis A. So, hepatitis A is not a novel disease by any means. It is believed to have first been described by Hippocrates and is believed to have been responsible for diseases that often occurred during wartime. It is a viral infection that is typically spread through contaminated food and water, as well as close person-to-person contact, typically via fecal-oral route, and it primarily affects the liver. Hepatitis A virus is a single-stranded RNA virus, and it replicates in the liver and is present in the blood and feces of the infected. Common symptoms include fatigue, nausea, and jaundice, which is the yellowing of your skin and eyes, but it can also be asymptomatic. Sometimes hepatitis A can even lead to severe consequences like liver failure, though this is uncommon and typically only affects 1% of the infected. However, it is something to note that these negative consequences can be more severe in individuals with weak immune systems, like people who are aged or don't have any vaccines, or just general things that contribute to weakened immune systems. For individuals without a vaccine, reinfection is common, and in relation to the vaccine was introduced in 1996 in the United States, and before this, it was the hepatitis A virus was widely prevalent. And although cases decreased after 1996, there has been a recent uptick in cases since 2018, which peaked in 2019 with a confirmed infection amount of 37,700 people. Risk factors for hepatitis A include those who use illicit substances, those who travel internationally, incarcerated individuals, those experiencing homelessness, and men who have sex with other men. Although, like previously mentioned, most individuals do recover, those that experience the negative effects, those effects will go with them for the rest of their lives. Additionally, vaccination status and access to safe food and water can affect morbidity rates, as rates of this disease tend to be lower when vaccination status and access to safe food and water are higher. Although it is now less common in the United States, it does have a large impact globally with over 150 million cases occurring annually. Additionally, 11.9% of US adults, despite a vaccine being available, only 11.9% of them have received the full vaccine. The age group with the most confirmed cases of hepatitis A are between the ages of 30 and 39, and men have almost twice as many confirmed cases. Additionally, hepatitis A is more common in urban areas and areas with poor sanitation infrastructure. And although the disease distribution is more uniform within the United States now, it is more prominent in the southeastern states.
In terms of intervention, the primary intervention for hepatitis A is the hepatitis A vaccine. Uh, the vaccine is the cornerstone of intervention. The vaccine does great at preventing hepatitis A from ever occurring in individuals who receive the vaccine. But as I stated earlier, the amount of people who have received the hepatitis A vaccine is 11.9% of US adults, which is not a lot. And so looking to have an intervention could possibly having expanding the vaccination program. So looking to target high risk groups. So those that travel a lot, those who have men who have sex with other men, those that are in poor sanitation area, like the homeless, and also people that potentially use drugs. Creating programs for them to be able to have a vaccine could help see the rates of hepatitis A go down. Additionally, looking to incorporate hepatitis A vaccines into childhood vaccines. Typically, when children enter into school, they're required to have a certain amount of vaccines. And introducing the hepatitis A vaccine along with the other ones could help see the cases of hepatitis A also go down, as the vaccine would help build a foundation for them to know that the vaccine is important and that it's accessible. Additionally, along with vaccines, is improving vaccine education. Many people are afraid of vaccines or think there's some big conspiracy theory going on with vaccines, and improving education that vaccines aren't something to be afraid of or scared of, but they're vital for our health, especially in the public, as we are all close together in contact with one another. Things happen, illnesses spread. Hepatitis A is one of those. And so improving education on vaccines, stating that it's not dangerous, that this is important for us as a society to have, and ensuring the public that it's safe. Additionally, looking to see infrastructures of cities. Hygiene and sanitation is a big reason for the spread of hepatitis A. And so making sure that education is heavily stressed out, and making sure that people know that they need to wash their hands, that they need to have good hygiene when in contact with others, and also looking to see that cities that may have poor sewage systems or water that's not clean and people drinking from it, making sure that cities are good on their sanitation and they're also good with their sewage, that the water is clean, that the participants of the city may be having. Lastly, when it comes to our target population of homeless individuals, there's many reasons why hepatitis A is such a potent disease towards them. And so when we improve vaccine education and look to intervene in that way, and if we improve vaccine access to them, additionally also making sure that this population is having access to clean water for them to be able to shower and wash their hands, and also making sure that the water they're drinking is also clean. These are areas that we can improve on to have opportunities to intervene in these individuals' lives. Next, we'll talk about implications.
Okay, so for the implications, I would want to talk about the socioeconomic status. So for people with that type of lower socioeconomic status, they often like face poor sanitation, like lack of water, lack of clean water, or even working bathrooms. They're limited to access to healthcare, whether it be like vaccinations or testing. Sometimes they even, I would say, are in crowded living conditions. So, like homeless people, like they're in shelters or in encampments, I think that's what it's called. But for the most part, these conditions do spread hepatitis A. So with the homeless population, like I said, they do lack clean of water, public restrooms, crowded shelters, and even sometimes, usually most people, they have substance use and mental health struggles. So complementing prevention efforts is a big deal with this. Sometimes they have difficulty accessing healthcare because they have no regular checkups with the updated vaccines or even follow-up care. I will say for how do I say this? The homeless, usually how we could improve this, I would say, is mobile vaccination clinics. So creating a mobile unit to visit shelters in areas where homeless people are located. These units could provide free hepatitis A vaccinations because, with homeless, they can't really afford that or don't have insurance for anything. Pop-up vaccine stations. They set up vaccine stations in public spaces, shelters, and even food distribution centers. Um, Usually for the homeless, you could partner with local homeless services providers to educate them about the benefits of vaccination and address common myths surrounding vaccinations. Because usually I've come around homeless people where, it was more of like health, trying to educate them, and sometimes they're not really mentally there. So trying to just educate them and like, be more vulnerable with them to like know, okay, like is a real health issue. We could work on this, and not even, you know try to we could even try to prevent it. So, improving sanitation, like washing stations, like placing hand washing stations, and in areas where homeless, gather, and just, are common, like public parks, and like I said, shelters. So I also think public restrooms ensure that are available and regularly clean. Because of that, it is contact, whether it's sanitation or hygiene, that you could get hepatitis A. Um, So, it would prevent overcrowding and reducing the risk of disease spread. We could even, I would say, make even hygiene kits, soap, hand sanitizer, menstrual health for women to homeless people to help them maintain personal hygiene. Um, so, despite positive strides made in preventing spread of hepatitis A since the introduction of vaccine, cases have increased and contributing factors need to be addressed. So, straining the vaccine outreach, like I said, investing in clean water and educating the public because I would say not many people know, the struggles of little things that they could do, like just the hygiene in general, how much hepatitis A can have an impact. So think that's it. If anyone wants to add anything to that.
I also think it's really important to focus on harm reduction strategies since they are evidence-based. Um, in the state of Texas, harm reduction strategies are very difficult to engage in because distributing clean materials to use drugs, such as needles, pipes, fentanyl testing strips, is illegal in the state of Texas. But when we engage in these harm reduction strategies, it actually improves the health outcomes of individuals when it comes to the spread of diseases such as hepatitis A. And additionally, those harm reduction strategies are a good opportunity to connect those individuals with resources and education. So, having policymakers that are focused on utilizing evidence-based strategies like harm reduction when it comes to diseases that are spread in this manner is really important, and ensuring that there's a good connection between health educators and policymakers and the people gathering information to ensure that anything that is being done is as effective as possible. And I believe that is all.
I will say the conclusion for this. So, like I said, hepatitis A is preventable, but it's highly contagious liver infection that can have significant health, public health, and economic health impacts. So, while most people do recover, usually without long-term effects, the disease can cause severe complications, especially those with high risk contact. So, like I said earlier, it is transmitted through contaminated food, close contact, water, and hygiene and sanitation. So, um, public health strategies, including routine vaccination and education, are essential to reduce the spread and consequences of hepatitis A, which are particularly in areas with poor sanitation or during outbreaks. So, for the discussion, we do have two prompts. The first prompt is: how can public health officials promote the hepatitis vaccine in an effective and realistic manner? The second prompt is going to be: how can local governments in rural areas like Hunt County, Texas, address the underreporting and underdiagnosis of hepatitis A?
Thank you.